Welcome to the presentation of the Healthwatch Lincolnshire Annual Report for our 2022 to 23 year, Shaping the Future of Health and Social Care in Lincolnshire. Hello, we are HW Links. HW Links is a people-first charity dedicated to improving well-being and influencing change. The engagement to insight experts, gathering people's opinions and experiences to provide independent understanding. HW Links are proud to deliver the Healthwatch Lincolnshire contract. Healthwatch Lincolnshire is your local health and social care champion, and the public is at the heart of what we do. We make sure NHS leaders and decision makers hear your voice and use your feedback to improve care. We are also here to help you find reliable and trustworthy information and advice. Here are some of the highlights from our 2022 to 2023 year. Services can't make improvements without hearing your views. That's why over the last year we have made listening to feedback from all areas of the community a priority. In doing so, we have had over 3,600 people share their experiences of health and social care services with us, helping to raise awareness of issues and improve care. This year we have reached different communities by holding dedicated focus groups and one-to-one interviews with people living with long-term conditions, including epilepsy, fibromyalgia, MS and ME. This highlighted in particular the difficulties people had in accessing services in a timely way and a feeling of disjointed services and the increased impact on mental well-being. A cost of living survey showed that the impact on people's health and well-being. Healthwatch Lincolnshire call for greater support for everyone, but especially those who are carers and have long-term health conditions and disabilities. We facilitated opportunities for people living with sensory impairments to join the patient panel at our acute trust, United Lincolnshire Hospital Trust. As a direct result of this, the subgroup have been involved in the redesign of areas of the hospital, taking into account both auditory and visual accessibility. We gathered the experiences from adults living with autism and learning difficulties to support the Care Quality Commission in helping services improve how they engage and feedback to this community. We have also seen an impact digitally, with our website seeing over 36,000 page views, and we have reached over 371,000 people across social media. Finding the right help and support can be worrying or stressful, but there are a number of organisations and communities who can provide this. But people just don't know where to look. And last year, our information and signposting team helped over 3,600 people who came to us for clear advice and information about topics such as mental health and the cost of living crisis. Here is just some of the feedback we have received from the public.
My sincere thanks for such prompt and helpful information. Fantastic service, it really is much appreciated.
Thank you so much for your information and advice. I was phoned yesterday and they are coming to see us this Thursday afternoon.
This year we've helped people by providing up-to-date information, including 22 new information and advice articles on our website. Examples include: how can your pharmacy help you? What is a GP referral and how can you get one? What is adult social care? And where can I go for support for my mental health as a new parent? You can come to us for signposting and information in a number of ways, including over the phone, use of our feedback form, raising your comments with our volunteers in the community, through our website, email, letter, or in person. Our Your Voice at Healthwatch information events have continued to grow in popularity. These events are free to attend for the public in Lincolnshire to listen, learn and discuss specific health and care services. Holding 2 very successful public Your Voice events this year with a variety of themes. We involved a panel of experts and encouraged audience participation through our question and answer sessions and marketplace full of local support services and organisations. Local Healthwatch have a statutory function to enter and view on a service, which is carried out by staff and trained volunteers in a professional manner. An enter and view is not an inspection, but rather its purpose is to observe the nature and quality of a service by speaking to people who use it and the staff who work there. We then report our findings and recommendations to the providers, local authorities, Healthwatch England and other statutory bodies as required. Over the last year we have conducted 21 visits and have made 13 recommendations as a result of this activity. Access to NHS dental care continues to be one of the main issues we hear about from the public. Difficulties getting support have led to many living in pain. Healthwatch have consistently worked closely to raise concerns with Lincolnshire MPs, councillors, NHS Lincolnshire ICB, NHS England Midlands Dental Commissioning Team, Healthwatch England, as well as with local and regional dental networks. As a result, we have contributed to the National Parliamentary NHS Dentistry Inquiry and provided evidence for the Health Select Committee in London. We await national changes that will support Lincolnshire people to get the NHS dental access they need. We're supported by a team of amazing volunteers who are at the heart of what we do. Thanks to their efforts in the community, we're able to understand what is working and what needs improving. We're lucky to have 36 outstanding volunteers who gave up 1,657 hours to make care better for our community. They are supporting us by collecting experiences across the whole county, carrying out enter and view visits to local hospitals, checking numerous GP and dentist websites to review accessibility, collected surveys as part of our work on the hospital discharge hubs, and our readers panel have been active in reviewing our own reports as well as external ones. We say thank you to all our volunteers. Here's what Janet had to say about volunteering with Healthwatch Lincolnshire.
I volunteer for Healthwatch because I like to keep busy and keep my brain active. Being able to work from home as and when I can is ideal for me.
In the 10 years since Healthwatch was launched, we've demonstrated the power of public feedback in helping the health and care system understand what is working, spot issues, and think about how things can be improved in the future. Services are currently facing unprecedented challenges, and tackling the backlog needs to be a key priority for the NHS to ensure everyone gets the care that they require. Over the next year, we will continue our role in collecting feedback from everyone in our local community and giving them a voice to help shape improvements to services. We will also continue our work to tackle inequalities that exist and work to reduce the barriers you face when accessing care, regardless of whether that is because of where you live, your income, or your race. We will continue to provide Lincolnshire people to have their say on health and social care, continue to conduct enter and view visits across the county, provide outreach information and signposting, increase our volunteer community engagement, and to continue to build strong relationships with service providers and commissioners, encouraging them to listen and involve their service users. We will also continue to share local voices nationally through Healthwatch England. Thank you. Your voice counts, and with you, we can make a difference. That was a quick overview of our year. Please do check out the full annual report and annual plan on our website.